Most of you watching this are walking around with a ticking time bomb inside your chest, and you're celebrating the wrong thing entirely. Your doctor wraps this cuff around your arm, it squeezes, and they shout out two numbers. Say, 152/78. You hear that 78, the bottom number, and you think, well, the bottom one is normal. I'm okay. That single thought, that dangerous, outdated misconception, is why patients end up on my operating table. If you are over the age of 60, everything you thought you knew about blood pressure is wrong, and the number you've been ignoring is the one that is quietly eroding your brain, straining your heart, and preparing to end your independence. I'm Dr. Liam Cooper. After more than 2 decades in this field, specializing in cardiovascular health and advanced surgical interventions, I have held hundreds of hearts in my hands that were destroyed by this exact misunderstanding. I have seen vibrant, sharp minds reduced to confusion because they watched the bottom number while the top number hammered their brain into silence. Today, we are going to fix this. In this video, I'm not just going to tell you which number matters. I'm going to show you why your biology completely changed the day you turned 60, how to identify the silent damage before it's too late, and exactly what advanced strategies you can use, starting today, to protect your future. This is not another basic talk about cutting salt. This is the advanced blueprint for cardiovascular longevity. Stay with me. What you learn in the next few minutes could genuinely save your life. This exact mechanical imbalance, where your top number shoots into the clouds while your bottom number stays perfectly normal or even drops, has a specific clinical name: isolated systolic hypertension. It is the single most common form of high blood pressure in individuals over 60, and it is also the most dangerous illusion in modern medicine. Every week in my practice, I see patients who look at a reading like 155/74 and say, "Dr. Cooper, look at that bottom number. It's fantastic. I'm completely safe." They feel entirely healthy. They don't have headaches. They don't feel dizzy, and they aren't short of breath. But beneath that calm surface, their internal organs are taking a catastrophic beating. To understand the sheer magnitude of this threat, we have to look at what this massive pressure gap actually does to your body. The difference between your systolic and diastolic numbers is called your pulse pressure. A wide pulse pressure is a direct, undeniable measure of advanced arterial stiffness. When your systolic pressure is running high, it means that every single time your heart beats, roughly 100,000 times a day, a high-velocity, high-pressure shock wave is shot directly out of your heart and slammed into your vascular network. The primary target of this relentless mechanical pounding is your brain. Your brain is the most highly vascularized, pressure-sensitive organ in your entire body. It relies on a continuous, perfectly modulated microcirculation system. Billions of delicate neurons are fed by tiny capillary beds, some of which are so narrow that blood cells must line up in single file just to pass through them. These microscopic vessels are designed to receive a gentle, steady stream of blood. They are absolutely not equipped to handle a continuous high-pressure hammer striking them tens of thousands of times a day. When your systolic pressure sits at 150, 160, or higher, those tiny, delicate vessels in the brain begin to undergo structural failure. To survive the constant pounding, the walls of these microvessels thickens and narrow in a process called microvascular remodeling. Over time, some of these tiny tubes develop microscopic tears, leading to microbleeds. Others become so narrow that they simply close off entirely. When they close, small localized clusters of brain tissue are instantly starved of oxygen and quietly die. You do not feel this happening. There is no sudden pain, no facial drooping, and no loss of speech. It is a completely silent, invisible erosion of your neural architecture. This is the origin of what we call vascular dementia. What should trouble everyone watching this is that the early stages of vascular dementia, the subtle memory lapses, the sudden confusion, the mild personality changes, look almost identical to Alzheimer's disease. In fact, in patients over 65, vascular dementia is frequently misdiagnosed as Alzheimer's, even by highly experienced clinicians. The profound difference, however, is that while we still struggle to find a cure for Alzheimer's, vascular dementia is highly preventable. Protecting your brain from this slow-motion destruction doesn't require a miracle drug. It requires aggressive, precise control of your systolic blood pressure. When we keep that top number managed, we stop the mechanical pounding, preserve the microvessels, and keep your mind sharp, independent, and firmly in the room. The stakes are truly that high. When we talk about controlling your top number, we aren't just managing a stat on a chart. We are actively defending your memory, your identity, and your cognitive future. We need to completely dismantle the old rules of medicine before we can look at your body today. For decades, the medical community pounded a single message into our heads. The bottom number, your diastolic pressure, is the absolute metric of cardiac health. The logic seemed sound at the time. The diastolic number represents the baseline pressure in your cardiovascular system when your heart is completely relaxed between beats. Doctors believed that if this baseline resting pressure remained high, it meant your heart was living in a perpetual state of stress, never getting a true break. The top number, your systolic pressure, the peak force when your heart actively squeezes and ejects blood, was largely dismissed as a temporary surge, a natural byproduct of aging that we should just expect and ignore. That outdated thinking is costing lives every single day. Over the last several years, massive longitudinal clinical data tracking millions of patients over decades has completely flipped this paradigm on its head. The rules change dramatically depending on your stage of life. If you are 35 years old, yes, an elevated diastolic number is a powerful warning sign of early vascular disease. But the moment you cross the threshold of 50, and especially once you pass 60, the biological landscape of your cardiovascular system undergoes a profound transformation. The bottom number retreats into the background, and the top number becomes an aggressive, dominant predator. To understand why this happens, you have to look at the structural reality of your blood vessels. Your arteries are not passive plastic tubes. They are highly dynamic, living organs designed to be incredibly elastic. When you are young, your artery walls are packed with a specialized protein called elastin. When your heart beats and ejects a massive volume of blood, healthy young arteries expand effortlessly to absorb that sudden shockwave of pressure. They act as your body's internal shock absorbers. Because they stretch, the peak pressure, the systolic number, stays perfectly managed and low. Then, during the resting phase between beats, those elastic walls gently snap back, maintaining a steady, healthy flow of blood, which keeps the diastolic number stable. But as the calendar turns, a process called arterial remodeling begins. This isn't necessarily a disease, it is fundamental progressive human biology. Year after year, the pristine elastin fibers inside your major vessels gradually degrade under the constant mechanical stress of your pulse. Your body tries to repair these microscopic structural changes, but it doesn't replace the elastin with more flexible material. Instead, it lays down rigid, unyielding collagen fibers. Calcium deposits begin to embed themselves into the matrix of the vessel walls. The result is a phenomenon I see in every single patient over 60, the stiff pipe problem. Think about a piece of flexible rubber tubing that has been left out in the freezing winter cold for years. It loses all its give. It becomes rigid, brittle, and completely unyielding. When your heart contracts and slams a volume of blood into these hardened, stiffened arteries, the vessels cannot expand to absorb the blow. There is absolutely nowhere for that kinetic energy to go. The high-velocity wave of blood hits a solid, rigid wall and bounces violently backward toward the heart. This immediate mechanical failure of the artery to expand is exactly why your systolic number suddenly rockets upward into dangerous territory. Meanwhile, because these stiffened walls have lost their ability to gently snap back during the resting phase, the baseline pressure drops or stays completely flat. This creates a highly deceptive clinical presentation that tricks millions of seniors every single day into a false, perilous sense of security. The destructive force of an elevated systolic pressure does not stop at your neck. It is a systemic, whole-body assault that leaves no major organ untouched. Because it operates without producing obvious daily symptoms, it inflicts deep, structural damage long before you ever realize you are in danger. Let us look first at the engine itself, your heart. When your systolic pressure is chronically elevated, your heart is forced to contract against a massive wall of resistance every single second of the day. To pump blood out into stiff, high-pressure arteries, the heart muscle must exert immense, unnatural physical force. Like any muscle subjected to constant overwork, the heart responds by thickening. The walls of the main pumping chamber, the left ventricle, undergo a process called hypertrophy. While a larger muscle sounds like it might be stronger, in the cardiovascular system, it is a structural disaster. A thickened heart muscle becomes rigid, less flexible, and highly inefficient. It loses its ability to relax and properly fill with blood between beats. Over time, this mechanical strain stretches the muscle fibers beyond their limit, culminating in a devastating condition known as congestive heart failure. Once heart failure becomes fully established in an older adult, it is notoriously difficult to reverse. It severely limits your mobility, causes chronic fluid retention, and profoundly shortens your lifespan. Yet, its root cause, the elevated systolic pressure that forced the heart to overwork for years, is entirely preventable. Simultaneously, this high-pressure hammer is relentlessly battering your kidneys. Your kidneys are essentially highly complex, dense clusters of delicate blood vessels that act as your body's primary filtration plant. Every single drop of your blood supply passes through these tiny vascular filters dozens of times a day. Chronic systolic hypertension exerts an intense mechanical stress on these fragile filters, causing them to scar, narrow, and structurally fail. The terrifying reality of hypertensive kidney disease is that it is completely silent. Your kidneys will continue to filter your blood even after losing a massive percentage of their functional capacity. You will feel absolutely fine. Your urine output will look normal, and you will have no pain. By the time a routine blood test finally flags elevated waste products like creatinine, extensive permanent damage has already occurred. If the systolic pressure remains uncontrolled, this destructive cycle accelerates, eventually driving patients toward chronic kidney disease, total renal failure, and the absolute reality of dialysis. We must also look at your vision. The retina at the back of your eye is the only place in the human body where a physician can directly observe living blood vessels. These microvessels are incredibly delicate and highly vulnerable to pressure changes. Chronic systolic surges cause these tiny ocular vessels to thicken, leak fluid, or spontaneously rupture. This condition, called hypertensive retinopathy, quietly degrades your vision over time. In severe cases, a sudden sharp spike in systolic pressure can cause a major retinal hemorrhage, leading to sudden and often permanent vision loss. When you look at the collective toll, the slow destruction of the brain, the progressive thickening of the heart, the scarring of the kidneys, and the degradation of your eyes, it becomes undeniably clear why a high top number can never be ignored. The damage is cumulative, happening beat by beat, year after year. The question you must ask yourself is not whether you feel okay today, but what your blood pressure is silently doing to your organs for tomorrow. Now that you understand the profound anatomical toll of this condition, we must look directly at the hard clinical data. For decades, the medical establishment accepted a highly dangerous myth: the idea that a systolic blood pressure of 140 or 150 was completely acceptable for someone in their 60s, 70s, or 80s. The common phrase used even by physicians was, "Well, your pressure naturally goes up with age, so we shouldn't push it down too low." Then came a definitive multi-center clinical trial that shattered this outdated thinking entirely: the SPRINT trial, Systolic Blood Pressure Intervention Trial. This massive landmark study followed thousands of adults over the age of 50 who were at high risk for cardiovascular disease. Researchers split the participants into two distinct groups. The first group received standard treatment to bring their systolic pressure down to the traditional target of 140. The second group received intensive precision treatment to drive their systolic number all the way down below 120. The results were so dramatic, so conclusive, that the Independent Safety Monitoring Board stopped the entire trial early. It was deemed unethical to keep the standard group at a higher number because the intensive group, those treated to a lower systolic target, demonstrated a stunning 25% reduction in heart attacks, strokes, and cardiovascular death. Furthermore, their overall risk of death from any cause dropped by 27%. This single study completely rewrote international medical guidelines. Today, the American College of Cardiology and the American Heart Association set the benchmark clear. For most adults over the age of 65, the target systolic pressure is firmly below 130, not 140. The evidence is completely unambiguous. Lower systolic numbers directly save lives after 60 by protecting the structural integrity of your blood vessels. However, as an advanced clinical strategy, we must also address an incredibly crucial biological nuance that often trips up routine healthcare providers: the relationship between a high top number and a very low bottom number. In older adults with advanced arterial stiffness, it is common to see a systolic number of 155 paired with a diastolic number that has plummeted below 60 or even 55. This creates a massively widened pulse pressure. Here's the delicate clinical tightrope we must walk. While we must aggressively lower that high top number to protect your brain and kidneys, we must do so with immense precision because your heart muscle itself receives its own blood supply, primarily during the diastolic phase, the resting phase between beats. If a medication drives your diastolic pressure too low, below 50, it can inadvertently starve the heart muscle of oxygen, leading to chest pain, demand ischemia, or localized cardiac stress. This is exactly why generic assembly line medicine fails seniors. Managing blood pressure after 60 is not about blindly popping a random pill to force numbers down. It requires a sophisticated, calculated approach that carefully lowers the aggressive systolic pressure while safely preserving diastolic perfusion to the heart. It requires looking at the human body as a complex hydraulic system, calibrating your specific targets based on your unique biology, your level of arterial stiffness, and your overall health profile. If your current provider looks at a systolic number over 130 and tells you not to worry because you are just getting older, you are receiving outdated care that ignores modern clinical science. To master this hydraulic system without relying solely on prescriptions, we must implement highly targeted, evidence-based lifestyle interventions. These are not vague health suggestions. They are precise biological levers that alter the physical forces inside your blood vessels. I have watched dedicated patients drop their systolic pressure by 15 to 20 points through these strategic shifts alone, completely changing their clinical outlook. The first and most critical lever is precision sodium management. As you cross the threshold of 60, your kidneys undergo a natural decline in their ability to clear sodium from your bloodstream. Because of this structural shift, excess salt hits your cardiovascular system far harder than it did 2 decades ago. When sodium accumulates, it acts like a chemical sponge, pulling massive volumes of water directly into your bloodstream. This sudden surge in fluid volume dramatically escalates the pressure inside your stiffened, unyielding arteries. The clinical target is strict, between 1,500 and 2,000 milligrams of sodium per day. To put that into perspective, a single teaspoon of standard table salt contains 2,300 milligrams, instantly obliterating your daily limit. If you want to make a real impact, step away from the salt shaker and start aggressively reading nutritional labels. The true drivers of hidden sodium are processed foods, commercial breads, canned soups, deli meats, and restaurant meals. Eliminating these hidden sources from your routine is a direct chemical intervention that slashes fluid volume and instantly relieves pressure on your arterial walls. The second lever is weight optimization, which operates on pure physics rather than aesthetics. Every excess 10 pounds of adipose tissue, fat, you carry forces your body to construct miles of new microscopic blood vessels to supply that tissue. Your heart is then forced to pump blood through this massive, expanded network, driving up systemic resistance. The math here is incredibly consistent. Losing just 10 pounds of excess weight drops your systolic pressure by 4 to 5 points. You are literally reducing the workload on your cardiac muscle by shrinking the size of the plumbing system it has to feed. The third intervention is consistent aerobic movement. The clinical protocol demands 30 minutes of moderate intensity activity, such as brisk walking, cycling, or swimming, 5 days a week. This routine lowers systolic pressure by an additional 5 to 8 points. The underlying magic here is that regular aerobic exercise directly triggers the release of nitric oxide, a powerful signaling molecule that forces the smooth muscle cells inside your artery walls to relax. This is one of the very few interventions that actively counteracts the stiff pipe problem, restoring a degree of youthful elasticity to your vessels. Finally, we must deploy structured stress management. Chronic psychological stress keeps your sympathetic nervous system in a perpetual state of overdrive, flooding your body with cortisol and adrenaline. These hormones cause immediate, sustained vasoconstriction, the tightening of blood vessels, keeping your systolic number artificially spiked. Incorporating dedicated daily relaxation techniques such as deep diaphragmatic breathing, meditation, or structured time in nature has been clinically proven to lower systolic pressure by 4 to 6 points. This effect directly rivals the impact of a low-dose pharmaceutical intervention by calming the nervous system and opening up the vascular highway. While these advanced lifestyle levers are incredibly potent, we must confront a stark biological reality. For many individuals over the age of 60, lifestyle modifications alone are simply not enough to hit our target of below 130. And this is where we have to completely dismantle a highly destructive cultural narrative. There is a pervasive myth in our society that needing blood pressure medication represents a personal failure, a sign that you lack the willpower to eat perfectly, exercise hard enough, or manage your stress. This dangerous mindset causes patients to resist treatment, skip doses, or completely ignore their climbing numbers. As a clinician, I need you to understand that after 60, arterial stiffness is not a temporary state of poor health. It is a permanent structural modification of your vessel walls. Collagen has replaced elastin at a cellular level, and calcification has fundamentally altered the hydraulics of your body. No amount of clean eating can magically turn a 65-year-old hardened artery back into a soft, flexible 20-year-old vessel. In this context, advanced pharmaceutical intervention is not a crutch. It is precision medical engineering. Modern medications like ACE inhibitors, angiotensin receptor blockers, ARBs, and calcium channel blockers do not just blindly force numbers down. They work at the receptor level to actively dilate your vessels, block constricting hormones, and drastically reduce the structural workload on your heart. These are some of the most extensively researched, rigorously tested compounds in the entire history of medicine, with safety profiles established across millions of patients. Needing them is not a failure. It is an intelligent, realistic response to your unique biology. However, whether you are managing your pressure through lifestyle alone or with the help of precision medication, you are completely blind without the single most underutilized weapon in cardiovascular medicine, a validated upper arm home blood pressure monitor. Relying solely on the readings taken inside a doctor's examination room is a critical clinical mistake. For a staggering 20% to 30% of patients, the sheer anxiety of sitting in a medical clinic triggers a neurological spike in adrenaline that artificially inflates their numbers, a phenomenon known as white coat hypertension. This can easily lead to overmedication. But the reverse scenario is far more dangerous and frequently goes completely undetected: masked hypertension. This occurs when your blood pressure looks beautifully managed and normal during the quiet, sterile moment of your doctor's appointment. But the second you return to the actual stressors of your daily life, your systolic pressure surges into the 150s and 160s. Because it looks perfect in the office, you leave with a false sense of reassurance, completely unaware that your brain and kidneys are being battered around the clock. The only way to eliminate this dangerous guesswork is to establish a rigorous home monitoring protocol. You must abandon inaccurate wrist cuffs and invest in a high-quality, validated upper arm cuff. The protocol is exact. Sit quietly in a chair with your feet flat on the floor and your back supported for a full 5 minutes before pressing start. Take 2 readings, spaced exactly 1 minute apart, twice a day, once in the morning before medication or breakfast, and once in the evening. Meticulously log every single number. A 7-day home log reflecting your real-life pressure during actual daily conditions is worth infinitely more to an advanced clinician than 100 single readings taken in a stressful exam room. It gives us the precise data required to make flawless, life-saving adjustments. Let us bring this entire conversation home. We have dismantled the myths, examined the structural biology, and looked directly at the definitive clinical data. If you remember nothing else from our time together, hold fast to these core truths. After the age of 60, the old cardiovascular rulebook is completely rewritten. Your systolic pressure, that top number, is the absolute indicator of your vascular health and your longevity. A high top number paired with a normal bottom number is not a sign of safety. It is an aggressive warning that your arteries have stiffened and that a silent, cumulative assault is actively targeted at your brain, heart, kidneys, and eyes. Your target benchmark is clear. Keep that systolic number reliably below 130. You have the tools to achieve this. Deploy the lifestyle levers of precision sodium restriction, weight optimization, aerobic movement, and structured relaxation. If your biological architecture requires precision medication to bridge the gap, accept that intervention intelligently, consistently, and entirely without guilt. Most importantly, eliminate the dangerous guesswork by tracking your numbers at home using a validated upper arm cuff to build a flawless record of your health. My challenge to you this week is simple. Track your blood pressure twice a day for 7 consecutive days. Write down those readings, examine the patterns, and bring that invaluable data to your next appointment so you can have a truly informed, proactive conversation with your physician. Please remember that all the information shared in this video is for educational purposes only. It is designed to empower you with scientific knowledge, but it does not constitute personalized medical advice or establish a doctor-patient relationship. Every human body is uniquely complex, so always consult with your own healthcare provider before making any modifications to your lifestyle protocols or medication regimens. I want to thank you for investing this time in your long-term health. If this advanced breakdown brought you clarity, make sure to subscribe to the channel, hit the like button, and leave a comment below with your thoughts or your home numbers. Share this information with someone you care about who needs to hear it. Take exceptional care of yourself, look out for those around you, and I am Dr. Liam Cooper. I will see you in the next video.